Hello and welcome, mental warriors. Today we are going to see what is social anxiety disorder, or also called social phobia. Social phobia is an anxiety disorder that makes a person feel fear in everyday social activities. They think that they will in some way embarrass themselves in front of others. This fear is irrational, and the person in most cases knows this. Even when the person is aware of this fact, they can't help themselves or control the fear. This irrational fear can affect your school, work, and every other social activity. As we said before, even though they know the fear is irrational or not real, they can't overcome it. They spend hours analyzing every social situation and interaction before and after the interaction. This social anxiety can sometimes be connected with a specific type of situation. Some people have fear of public speaking. Others have fear of speaking with strangers and meeting new people. When a person has this fear, they experience typical symptoms of anxiety. These symptoms can make a person avoid this situation. This will have a negative impact and severe consequences on a person's life and success. Physical symptoms often accompany the intense stress of social anxiety disorder and include sweating, difficulty speaking, redness, and trembling. Also, when a person has social anxiety disorder, they often worry about these symptoms, and this is how they trigger them. Social anxiety usually goes together with other disorders such as panic attack, general anxiety disorder, and depression. A person with social anxiety often uses alcohol and other substances to control this fear. This leads to the development of addiction. What are the symptoms of social anxiety disorder? Social anxiety disorder can be diagnosed if a person has fear and avoids a social situation in advance, and this interferes with their daily routine. The main criteria for diagnosing social anxiety disorder are: a person with social anxiety has fear of any social situation in which the person can be judged by other people. For example, meeting new people, eating or drinking in public places, having a public speech. The person fears that they will embarrass themselves in social situations. Being in a social situation always causes anxiety symptoms. Social anxiety disorder can be diagnosed only if this fear lasts 6 months or longer. The physical symptoms are trembling, sweating, blushing, shortness of breath, difficulty speaking. What is the prevalence of social anxiety disorder? Social anxiety disorder is more common in women. The disorder develops usually in childhood or adolescence and rarely after the age of 25. Situation that triggers social anxiety: answering the phone, speaking to a group of people, meeting new people, speaking to a teacher or other authority figure. Causes: social anxiety disorder is heritable. Research is focused on the idea that heightened sensitivity to disapproval may be physiologically or hormonally based. Other studies are focusing on research on environmental factors and their influence on the development of social anxiety. What can cause social anxiety in children? Child neglect is a big risk factor for the development of social anxiety disorder. Children who experience bullying, humiliation, and trauma may also develop social anxiety disorder. Treatment: social anxiety can be treated efficiently with two types of treatment: psychotherapy and medication. Cognitive behavior therapy is also a great way of overcoming social anxiety disorder. The main goal of this cognitive behavior therapy is to reduce fear by eliminating thoughts or behaviors that maintain social anxiety. Exposure is the main element. This means that the person must face the fear. First, an individual is introduced to the situation they fear. After that, the risk for disapproval is increased in that feared situation, and the individual can build confidence that he or she can handle rejection or criticism. Teaching the person techniques that will help them cope with disapproval is also an important phase. In this phase, the individual is asked to imagine his or her worst fear and they should develop constructive responses to this fear and perceived disapproval. At the same time, the individual has anxiety management training. The individual is taught techniques such as deep breathing to control their anxiety. This should be done carefully and with support from a therapist. Exposure to the fear should be done with care and when an individual is prepared. This therapy lasts typically 12 weeks. Medications can also have a positive influence. Medications, together with psychotherapy, can help the individual get over anxiety. Medications used in this case are antidepressants and high-potency benzodiazepines. Individuals that have social anxiety can also use beta blockers. This medication lowers heart rate and eliminates the physical symptoms of anxiety. Thank you for watching. We would really appreciate if you subscribe and like this video so we can continue sharing mental health content.